We shall start. And
Okay.
welcome everyone to our IG Live today. Maybe Joey, you can introduce yourself first.
Yeah. So hi, I'm Jovine. I'm a trainee counselor and I'm now working in Process Psychology Center. Yes.
Nice. Okay, and I'm Yi Ching. I'm a clinical psychologist working at Process Psychology Center as well. So hello everyone. Today we are going to talk about this title, therapy versus not therapy. And what would you like to introduce about our topic today, Joey?
Yeah, so actually is how do you know that if you are in a genuine therapy session with a trained professional? So
Mm.
today's topic is very important because there are many people they are not sure how to recognize a legitimate therapy sessions or to know that whether are they seeing a qualified therapist. So we are going to break that down and then we will talk about qualifications, what to expect in therapy and how to
Mm.
advocate yourself if you feel something is off or something is wrong. And I hope by the end of the today's life, you will be more confident and more prepared to take your step toward your mental health wellness journey, or even just be a part
Mm.
of mental health industry. Yep. And
Okay.
yeah,
So,
yeah.
Jomin, why do you think is it important for people to listen to our life today and to know how to differentiate who, whether they are in a genuine therapy session or not?
Actually, I think right because like
Mm.
what I say, what we are going to cover is kind of like a common things where I actually talk with someone around me, and then they
Mm.
will be very
Mm.
confused with it because I'm now in my
Uh,
trainee, right? And then I have
mm.
relative or friends around. When I tell them, oh, I'm a counselor, I'm a trainee counselor, and then they thought like, oh, are you like what do you do, they
Mm.
don't really know, and
There's
they don't really
not
even
much
know
concept
what.
of
Yes,
the
yes,
the concept of how therapy works, what is it really like. So when
yes,
they go outside to seek, maybe if they when they have the need, when they really see the need, but they don't have the knowledge of how is it like. So they are confused of is this the one that's
mm-hmm.
really suitable for me? Is this really the one that's helping me or not?
Yep,
So
yep,
that kind of knowledge and awareness is important, right? For someone who
yes,
is trying to start their mental health journey.
yeah. I think it's also
Hmm.
to how to say that, to this is like a very important thing for them to actually before they step
Hmm.
into it, because if they receive uh a service from a non-qualified therapist, it
Hmm.
could probably lead them to, bad impressions toward mental health. So they will be
Yeah, there's a
going
possibility
back
for
to
that.
square one. Yes, right. They were going to be in
Hmm.
square one again, thinking that, I should just solve my own problem. I shouldn't reaching out to any other one because they got
Yeah,
hurt. They
that
might got traumatized.
hmm.
Yeah.
That kind of reduce the possibility of them seeking out for mental health help again because of
Yes, yes, yes.
the possible, when someone who is not qualified to offer
Mm,
the therapy-like services, and that
yep,
might cause some negative impressions in the overall mental health industry. That's why this
yep,
life itself is offering these kinds of information so that before you embark this knowledge, it's like doing some research before you do the practical things, right? So this life itself is offering these kinds of information lah. Alright, so
yep.
Jolene, what else would you like to talk about regarding our topic today?
Uh, so I think we will start with how to qualify, how to know that whether is that a qualified therapist.
Mm,
So I would
mm,
like to explain a bit about those like licensing or like the regulated
mm,
body things in Malaysia. So actually in the context of Malaysia, the counseling profession established their own regulatory bodies under the government before other mental health professions. Okay, so if you want to become a licensed counselor, these individuals or you have to complete a degree or a master degree in counseling that fulfill the
mm,
requirements set by the Malaysian Board of Counselor, which is
mm,
LKN, Lembaga Counselor Malaysia. And you have to also, after you finish your study, you have to pass the interview. They will have the interview with you. So after you pass the interview, only you can obtain your counseling license. Yep.
I see. Okay. So before we continue with further qualification, let's talk about that. Some of the more common therapies, mental health therapies that offer this kind of mental health therapy. Where today we are focusing more on counselor, more on clinical psychologist, because this is what we are lah.
Yeah.
Jolene is a
Yes,
counselor,
yes.
I'm a clinical psychologist, so we have more knowledge in terms of these two occupations. But of course, there are other kinds of therapists that may not be like well known, or maybe not so common, like we know of hypnotherapists and other kinds of maybe spiritual therapies. Those are not, although they are a part of therapies that offer these kinds of services, but I would say in terms of qualification wise, maybe they are still not so established lah,
Yep.
in terms of
Yep. Yep.
whether is there a government regulatory body or not. So today we are talking more on those that are more established in Malaysia,
Yep.
the ones, the occupation therapists that can offer these kinds of mental health therapies with the regulation of a government body. This
Yep.
is what we're talking about. So I will
Yep.
talk about a bit on clinical psychologist part, where if someone wants to become a clinical psychologist, first step they have to complete a master's degree in clinical psychology in the institutions where it's recognized by a government regulatory body we call Malaysian Allied Health Professions Council. So it's a council, government council that is regulating clinical psychologists. Now you have to, it's the institution needs to be recognized by them. So, and you finish the master's degree in this institution, and after that, when you have meet the requirements they set for you to apply for the registration, then you can register with the MAHPC, the short form for the council. Then after you got your registration number, that's where you are able to legally practice as a clinical psychologist in Malaysia. And then other than that, actually before this MAHPC was established in few years ago, actually last year it's officially open for registration. Before that, we also got MSCP, Malaysian Society of Clinical Psychologists, to regulate. This is like a private, a society that clinical psychologists in Malaysia established to privately regulate the activities of clinical psychologists. So we also have to acknowledge the contribution of this society, MSCP, towards the practice of clinical psychology, is the ethical practice. And also, if we talk about psychologists, there's also different specialization that exists in among psychologists, like forensic psychologists, neuropsychologists, health psychologists, and developmental psychologists. There's also like organizational psychologists and all. But they do exist. This occupation do exist in Malaysia, but there is currently, as far as we know, there is no government regulatory body for them. So maybe they have their own private, their own regulation among themselves. But in terms of government regulatory, counselor and clinical psychologists have these kinds of
Regulatory
regulation.
body. And also
Okay.
to add on that, the licensing requirements are different across the country. So if you are from another country or from another places, please do check and understand the guideline in your area so you can advocate for yourself. Yiqing,
Yes.
can you hear me? Because you're a bit lag.
Yes.
Yeah. Yeah, okay.
Ah,
Yeah, but yeah,
okay. Yeah,
okay.
I can hear you now.
Yeah, okay. Yeah, I think just now was a bit like broke off. So yeah, so it's very important for you to understand your own your country's regulations for this mental health industry. And also it's very important for you to actually understand these different professions and all that. It's because you can actually get the right help or right kind of support based on your specific need. And licensed professions in Malaysia must meet educational, ethical, and professional standards to their practice. Yep. So this, in other hand, is saying that it could help you to get a proper trained ethical therapy service. And in the same time, when sometimes you will see coaches, or consultants and all, sometimes they don't really go through this formal training or license, but they do maybe offer services that is resemble to therapy, but it may not be a real mental health therapy session. Yes. So for example, in Malaysia, there is a norm of we call consultant as counselor. Yeah, that's what happened because I was telling you about, like, when I was talking about I'm a counselor to my friends and family and all, they'll be like, oh, so you do give advice, you do give like solution consultation, is it? And that's kind of like a norm in Malaysia. But for those consultants, they might not obtain a license. Those consultants out there, they might not obtain a license, or they will just give you advice related to your issues. But be aware that there's difference between licensed counselor and what's so-called a counselor. Okay, so in fact that they might be just like what I said, a consultant or just a normal coach, and which they are not supposed to give mental health therapy. Okay, but uh, like I mentioned, right, because they haven't gone through this proper training, so they are not supposed to give that. And it's also actually not very suitable for them to use the counselor words without the appropriate qualification, because some of these individuals, they don't have this license and they misuse this professional title. It may have the risk of misleading the client and also potentially causing harm, or hurting the client without this certain knowledge or without this certain training, so they don't know how to handle. They might just re-traumatize the client or hurt the client again, like what we say, causing bad negative impressions toward this mental health. And also it could also undermine the reputations of those ethical practitioners who have completed years of rigorous training. Yeah, yeah. So Yiqing, would you want to add on something or anything else you want to
Yeah.
say? Yep.
Yeah. So the part where you say that when they are not receiving the training, they haven't gotten the qualification for mental health
Mm,
therapies, and then they offer these kinds of therapy-led services. So I think it's important for people who go and seek for these services to know how to handle the expectations, because if the person is not being trained well, don't have a appropriate qualification for providing this kind of services, so in that case there might be some things, some expectation that maybe they are not able to meet
yeah.
from the for the clients. So in that case it's important to know about this qualification. Why we are talking about this
Mm,
technical thing for qualification is because
yeah.
for clients it's important to know what kind of qualification can offer what kind of services. So for those without qualification, maybe they are not able to provide certain kinds of uh, um, professional therapy lah. Mm. So
To add on that,
moving
so, oh,
forward.
sorry.
Okay, yeah.
Yeah, sorry. I actually, yeah. Sorry. So,
Yeah,
so
you
just
can
to
add
add on
on.
a,
You can add.
yeah, just to add on a bit because we will be talking about, how to advocate yourself, like we said in the first, how to advocate yourself in later, about how to actually see whether are they qualified or not, how to get your rights as a client. So, but before that, we will go into telling you what actually a real therapy session looks like. So, Yijing, would you like to introduce that how is a real therapy session is?
Okay, so before starting the therapy session, of course, from the client itself, they might feel nervous. They have to go make an appointment with a contact person of this center, and then when they come, they have to make, of course, the procedure, making payments, waiting for the therapist to come to meet them and all, or waiting to go into the therapy room. So those are the process of before you go into the therapist room. So after, when you go to the therapy room for the first time in the first session, usually the therapist would start by building rapport, maybe greeting, some form of informal conversations about how's your day, or maybe just to briefly introduce, getting to know each other. So like when we start to get to know a person, of course we will talk about something, or just chit chat about something informal, make it a bit more relaxing. So probably they will. So some therapists likes to start with this kind of relaxed, calm manner first before going into the real deal. So after that, they would, of course, maybe they would brief the what's that called, regulation or confidentiality of how is it like, because some people maybe they are concerned about, if I share about my concern with the therapist, will it get leaked out, or will it be shared inappropriately with people? So don't worry about that. The confidentiality is maintained, is protected in the therapy session. So a therapist who is trained and properly qualified, they are aware of this kinds of this kind of regulation and ethics lah. So they will inform the clients, and they will abide by the ethics. And then after that is more on the exploration, let the client talk about their issues, when let the client get comfortable. So after they talk about it, and towards the end of the first session, maybe they will also go into like goal setting, setting a goal for the therapy, so that the clients know what to expect for the future sessions, and maybe also explain how would the plan for the future sessions looks like. Um, so this kind of goal setting and planning is a key part of what a therapist may include in the first session. And yeah, that's the structure, how it usually go lah for the first session. Okay, Joey,
And also,
what about you?
and also to be add on a bit, like the qualified therapists undergoing professional training, they know how to handle the expectations of client in the initial sessions, and they will tell the client that how is it when you are in a therapy sessions. That's the very important part, which I didn't even know that before I actually learned about mental health, like counseling things and all. Only I know, oh, we are supposed to do that. Yeah. And that's the real part of like profession who get this training, they know how to do that, to build rapport, to also maintain this professional therapeutic relationship with the client. Yep. And besides, maybe we can introduce some of the, like therapist approach to the audience.
Yeah, that's
Roughly
a
they
good
know
idea.
about some of the approaches. Yeah. Maybe first. So in counseling, centered therapy. So we call it in a short term, which is PCT. And this is a approach that focuses on the client's perspective and values a non-directive style. So it allowed the client to actually guide and lead the conversation, while the therapist will provide empathy and unconditional positive regards to the client. Yep. And Yichi, would you like to tell them about the common approach that used in clinical psychology?
Yes, yes, sure. Sorry if I respond a bit slow. It's sometimes a bit laggy,
Yeah,
but I
I
hear
think
you.
the yeah, I
Okay.
think the thing is a bit like
So yes, another more common approach that we usually use in mental health therapy is called cognitive behavioral therapy, which the short form is called CBT. And in this approach, we focus on the thoughts, the emotions, the behaviors, how this uh, when we face any kinds of life challenges or situation, how these three elements influence each other, how they influence our mental health. So the CBT itself is focusing on these three elements, how to improve each of these elements, but the root cause is on the thoughts itself. That's the theory that this CBT use mainly to work on this underlying belief, thoughts, um, yeah, the belief system itself is the one that can make the most impactful change if you work on it with the therapist. So some of the techniques maybe it's including like cognitive restructuring to increase the awareness of how some of these thought patterns may be causing unhelpful consequences or the emotions and behaviors can get affected by the thoughts themselves. And how to reframe these thoughts is what CBT focus on. So in a way, it can also help the client to learn in a long term, in the future, learn how to identify and modify these thoughts on their own. It's like they are also learning the skills for the
yep,
future use. It's not just in therapy, it's also something they can use outside of therapy.
understand.
Hmm.
So after Yichi explained about this, please do remember that there is a reason why we are telling you about the approaches that therapy
Yeah.
use. We will talk about that later on the third topic, but now maybe we can further
Yeah.
continue in talking about like maintaining boundaries and ethical conduct. Okay, so actually,
Hmm.
to have to therapists have to maintain a for the profession and including how they interact outside of the session. So, for example, whether or not a therapy will say hello if they see their client in public. It depends on the previous discussion of therapist with the client because this could expose the client confidentiality of seeing a therapist. So it's this boundary with the client together. Discuss about this. Discuss about the yes and no, what they can do, what they can't do. And also be aware if a therapist who show kind of like a inappropriate personal interest in you or kind of like encouraging a non-professional relationship, for example, like crossing emotional boundaries. And I think like you can see sometimes therapists will show over involvement in or maybe nonsense or emotional involvement in personal matters or too much self-disclosure. And this is going beyond the professional relationship and it might cause this confusion, discomfort, or even emotional harm to client. And this is a clear signal that something is wrong. But to be aware that not to say that people who are trained professional or people who are unqualified will, both of these, they might have these same issues there because that is depending on the therapist itself. Okay, for the unqualified one, because they are not trained, because they might don't know how to build these professional boundaries. But if you realize these are qualified therapies, it could also be happening. But yeah, we will tell you what to do later. So maybe Yiqing, do you want to add on something, or do you want to go further to the next thing?
Okay. So, when you notice these behaviors that might seem inappropriate, that so you might also feel that something is off, like maybe it's their approach or maybe how they behave in therapy. I mean, the therapist itself themselves, how they behave in therapy, and also maybe the vibe that they give you, some of these actions they do. If you feel that there's something off, so it's important to acknowledge your own feelings.
Mm,
Maybe your instinct might tell you, oh, something feels off, but I'm not
yeah.
sure what is it. It's important to acknowledge that, but because what you feel is that does matter in your own mental health therapy journey. However, other than acknowledging your own feelings and your own instinct, it's also important to research, to clarify and communicate. You can do the research on your own, or you can ask the therapist themselves to clarify about some of these emotions, this feeling off that you experience. You can clarify with the therapist themselves of, oh, what's actually happening? Why do you feel like this? Maybe the therapist themselves, they will help you to explore. Maybe they will explain about why this emotion come up. Or
Mm,
if you feel that it's still not enough, you can go do research on your own, because learning how to identify the reality other than your own emotion, learning how to identify the truth, what's actually happening. That's also a part of therapy, to learn to identify what is the facts, what is not not the facts. Like some feelings, they might not be accurate, so you have to have some curiosity to understand, why does this emotion happen, or is there any facts behind it? Is it really because of this um this objective facts that's happening, that's why I feel like this? So this process itself is something you through therapy as well. So later on we can also talk more about what to
that
do
right. We can
in terms
talk
of
more about that.
addressing these feelings, unsure
Mm.
feelings, right? Hmm.
I think except
Okay.
except for unsure, sometimes people also
Hmm.
do have needs towards therapy session, I guess.
Hmm.
And because that's
Hmm.
what I really heard from people, like they were just telling me that, I thought that I get therapy, I will get advice or maybe solution from my therapist. And in reality, this is not true. This is something very off, where therapies actually we don't give advice or we don't give solution. We give guidance because therapy is a process of guidance. So we guide the clients to explore about like what Yiqing said, their issues, their concerns, their emotions, their feelings. Instant
Hmm.
result is not supposed to be expected because some people think that they come in 1-2 times and then they will get solved. Everything in their life will get solved. But the progress is actually depending on the individual situations and also the willingness to engage, to work on in the process of this therapy. So whether they wanted to open up, whether they want to work together with the therapist to help themselves is is a thing that we need to see. And this is not like when you are having headache and then you eat painkiller, it will cure instantly, right? Because this is about mental. This is about your mental well-being. So, and when we mention about mental well-being, people also do have this myth thinking that, okay, I must be very crazy. Only I can go for therapist. They think like therapy is for people who are with severe mental illness. But no, it's
Hmm.
actually no. Therapy could actually give you a space to actually explore yourself or even coming to finding out your personal growth and all. Is maybe it just you need someone to listen to you about your concerns, and these therapists will actually guide you through the process, right? And yeah, and is there any myth that I've heard from someone else, like some other people, like about the myth? Is there any other myth?
Yeah, that there's also this myth that therapy is just talking. So it's I
Uh-huh.
just talk to you. Why should I pay so much for someone to just listen and talk? But actually therapy is much more than that. But because like previously we also talked about what actually happens in therapy, how the therapist would get training of knowing what to say at what time, how to say, and how to listen, how to reflect some of these insights for the client to gain these insights. So there are a lot of techniques involved in the conversations in therapy. So it's not just the usual casual talking we have with our friends. It's a lot more detail, there's a lot more training required for someone to conduct
Yeah.
mental health therapy. So it's not just about talking, it's more than that.
Mm,
Mm. So that's the
yeah.
myth that
And
I
also,
heard lah.
yeah, and also I think to something is also similar, which I heard another way is you are just listening to my questions and you are just listening to my concern. You are just sitting there and listening to me. Like what we say, right?
Mm,
Because we are trained in certain way, and then we know
mm,
we need to know how to handle the sessions. And like what Yiqing said, is more
mm,
than that. We need to process, we need to analyze, we need to do guidance, we need to guide the client to go to the pathway they want. They are they are they are, sometimes things are underneath, so they didn't find out what they really want. So maybe we can help them to find what they really want in their life. There's there's a lot more than just sitting there listening to you or just simply talking to you. Like
ah.
a
There's
chatting
also the
sessions with
concept
friends.
for self exploration and personal growth,
Yes,
right?
yes, yes, yes,
Ah,
yes. Yeah.
yeah. It's not just chatting, but through uh, trained talking with a trained therapist can help you to
Mm,
achieve this self-exploration and personal growth lah. So there's a
yeah.
purpose in this talking, not just casual talking just to spend time. It's more than that.
Yeah.
All
And
right.
this is
So
this is yeah,
uh,
sorry. I think
yeah,
it's
you
a
have
bit
something you
lag
want to add?
between us. Yeah, I think it's a bit
Uh,
lagging between us. So I just want to add on something. This is very, very important for you to realize that if your therapist is starting to give you a lot of advice, that might be a thing for you to be careful of, because sometimes we don't know. Like therapists actually won't give advice that, like we basically don't give advice or solution towards your problems. So if your therapist is giving you some advice or too much advice, you have to be aware of that also, right?
hmm. Advice to a certain extent, some advice is
Okay.
relatively fine
Yeah, some,
if the
yeah, but
client
not,
is okay with
yeah,
getting some advice or maybe getting some guidance, but too much
not
is a
too much
bit
is, yeah,
not so
yeah,
too
yeah,
much is not so appropriate. No?
yeah. And
Yeah.
so yeah, after
So
that
mm,
after that we are going to talk. So what to do when you are having all this
yeah.
unsure thing about your therapies,
Yes.
right? So we are going to this part
Yes.
where how do you find out whether are they
Mm.
real trained professions or not?
Yeah.
Yeah.
So one of the things that we discussed previously is about qualifications. So in qualification means that if the person has this qualification, means that they have already completed they have obtained the training, they have the appropriate knowledge to conduct allows them to do. So if the qualification is like master's degree in clinical psychology, so they are allowed they are equipped with the knowledge and skills to conduct assessment, to conduct therapy, and some other services that are related to what the clinical psychologist is able to provide. So one of the most important steps, if you want to check what's your therapist qualification, is to know you can ask your therapist about the details for the education background or their qualification, and if you need to have more objective evidence, then you can also ask for their license number, and there are also some professional online directory for professional bodies that you can check their license number and to verify their credentials on the website itself. So it's quite easy. You just obtain the number, and then you can go online and search, oh, is it on the website, the related website, and search their number and see if they are really registered with the body or not. So qualification may vary depending on where they are trained, where they get their license, and what they studied about for their qualification. So this kind of qualification, although they may vary, but because like different countries have different training, different kinds of qualification needed in order for a therapist to practice. The most important for Malaysian context, when you are searching for mental health therapy in Malaysian context, the most important for the therapist is to have the appropriate uh, to be registered with the appropriate professional body, to have the appropriate license for them to be able to practice in Malaysia, no matter what their qualifications are lah. Because sometimes even if your qualification is different, you may still be able to obtain the license with appropriate support for your
Yep.
own practice.
Yep.
So some of the ways of finding information related to the qualification is seeking consultation from a mental health professionals, and so these are the to ensure that your therapists are the authentic and legitimate ones.
Okay.
Okay. So Jovin,
Okay.
what would you like to talk about, or what to do?
I think except for the qualification itself, like of course sometimes if you feel that something is wrong, like we said before, right? When your instinct tells you something is feeling off and all, and you might feeling that, is this qualifications, therapies and all, you check. You have to do your research sometimes because um we don't know what kind of qualification the therapist will give you, right? So you have to do your own research. But besides on the qualifications, the approaches that we mentioned, the common approaches used in therapy session, would also be something that you can talk to your therapist when you're feeling unsure, you're feeling not right, and you can actually also ask your therapist about what approaches they use. So we have various approaches, right? So uh, each of these approach actually they have their own method of addressing different issues. And why does it matter? Why client have to know? Because clients should be feeling empowered to ask about the therapist's approach, because some techniques work better for different people, different issues, these different concerns. And it's important to understand that how this will help with your specific situation. Please uh, feel free to actually ask your uh, therapist, like, how is this going to help me? Why are we using this? Or even just tell them, I'm not feeling very comfortable using this way of you doing the sessions with me. And then the therapist will guide you, or they will clarify with you what's and more aligned with the process of therapy. And because I do understand that a lot of people actually didn't know that there was this different theory or approaches used. That's why here with this IG Live, we are telling you that there is approaches, there's different approaches. And sometimes before you making any decision to your therapy progress, you are very strongly encouraged to ask. You're unsure when you feel something is wrong, you just ask. Don't be afraid of asking because a professional trained therapy, they will help you do their best to guide you. You only will feel like, okay, I'm feeling better after going through this therapy session. This therapy session might help me. It aligns with me, right? So, but when you after like everything happened, like after you ask and all that, right? But you still feel like, I still don't feel like something I want, I don't feel really right. It's okay. We can ask for a referral. We can ask to switch to another therapist if you want. And because this is kind of like a way of advocating for yourself, if you really feel everything is off and you don't really want to continue with this current therapist, you can say, can I have a referral to other therapists? Maybe that could help me better with my problems because
Yeah.
we also do have different specialties, right? Like yeah. Yep. And
So
yeah.
one part of an important part of in the therapy, what you learn in the therapy itself is actually communication. When you
Yeah.
are communicating with the therapist, those communication skills can actually be used outside of in
Mm.
a different settings as well. So the actions of asking, clarifying, uh, going back and forth to know each other's about each other's thoughts,
Mm.
what you see, what's your perspective. Those are part of the skills you can learn through therapy. So clarifying itself is not something to be afraid of. You can always
Yes.
ask the therapist to let them clarify themselves, help them understand what you need for clarification. So don't be afraid to ask and clarify. And of course, if even after clarifying and after enough adequate communication, you still feel that maybe not really the suitable one for you, of course, the referral for another therapist is an option that's
Yep.
recommended rather than stopping the therapy
Yep.
session. If you stop therapy session, that means you stop learning for the what you can do better for mental health.
Yep.
Then it's better to learn from another therapist then. Uh,
Yes.
okay,
Because I
so
think
back to
in
you, Jovi.
Malaysia, yeah, hi. So actually, I think in Malaysia, I think there's a lot of platform or I would say center to provide different kinds of like mental health things and all. So like in our center, we do give a lot of like couple sessions, family sessions, individual counseling, career counseling, and different things. And you can find the things that you felt like is most aligned with you, or you can find a therapist that's more aligned with your concerns. You need to see what you really want to discuss, and you can find a therapist that maybe you think that it could help you, and then you at least try with it first. And it's like what Yiching said, if you don't even try or like you stop doing it, it's like you stop learning to help yourself to feel better, to regulate your emotions and all. And yeah, we are trained to guide you through your mental health mental wellness journey. Yeah. So it's not only advocating in therapy process itself, it's also advocating for yourself in real life. You are helping, you are trying your best to do something for yourself, right? Yep. And yeah, and then yep. So are we going to open to the
Yeah,
floor for questions?
we can open the floor to any question, but it seems like for now there's no questions that's been
Yeah.
proposed. Lah. So in that
I
case,
actually
maybe the
I
for
actually can't see
for
any
you, do you have
comment. I can't
Same
see
for
any
me. Maybe
comments or anything.
there's
Yeah, I think maybe
no
it's nothing. Yeah,
comment. Uh, uh, so in that
because
case, we can
yeah,
go for
summary,
the
conclusion.
summary itself.
Yeah.
Yeah, yeah.
And also, actually, sorry guys, because I think
Mm.
our Wi-Fi today is not very stable, so sometimes we will be a bit lag or broke halfway, and we don't actually realize that,
Yeah, I think my
right?
part is especially sorry about
Yeah,
that.
I think we have a bit like delay between us, but I think it's okay.
Ah,
So thank you guys for actually watching this live today. And today we covered, how to find out whether is that a qualified therapy, and how do you find out, whether are they qualified or not, through what kind of small things you can see, you can tell what we have told you. And also remember to do your research if you think they are not legitimate therapies. Okay, and next we also tell you how to what are you going to see in a real therapy session, like what is happening in a real therapy session. And yep, the most important one, what do you do when you feel unsure? Like we say, right, for qualification, you can do your research, you can find online now. But when other times when you feel unsure, when you are in a therapy sessions already, communication is the key. Communication is the most important thing. Yeah.
mm,
Communication not only happen between you and your therapist, sometimes you also have to ask yourself. You have to communicate with yourself to ensure that, oh, is this working for me? Yeah, how do I express my needs? How do I help myself? How do I advocate for myself? Yeah. And also to remember that therapy is a tool for self-growth, and you have the right to advocate yourself at every stage of your mental health journey. Yeah. That's all from me.
mhm.
Yijing, would you
Yeah.
like to add on anything?
Yes, it's encourage for people to take that first step
Yeah.
to go for mental health therapy. But of course, before taking that step, it's very helpful for you to learn to research first of what might happen, what are things you need to take note
Mm,
of. Like maybe through this live, I hope the audience can learn about what to take note of before they go and take that first step. But after this live, I hope the audience is more ready. If they need the help of mental health therapy, they are more ready to take that step. Then, okay, that's all for me.
yeah.
So, if there's no question from the audience today, that's all for our IG live today lah. Anything from you, Joey?
Mm, if you have any concerns or anything, you can actually find us also. You can, text us through IG or different social media or through our website,
Yeah,
reach out to us,
yeah.
tell us about your concern, you know, advocate for yourself. If you need any help, any mental health support and everything, just reach out. Don't be afraid. Right?
Yes,
Yes.
that's right. So that's all for today. And we'll see you again next time. And have a
Bye
nice day
bye.
and bye bye.